Um, Good morning. I'm Callistus Ditah. I'm one of the cardiac surgeons here at Upstate Medical University. I'm immensely grateful for the opportunity to participate in this new faculty lecture series. I am going to discuss a little bit with you today about myself, and a lot of this is not going to have anything to do with cardiac surgery per se. But it will be mostly sharing my background with you today and sort of kind of where I come from. Now, there's an old African saying that says it takes a village to raise a son or daughter, and I certainly stand here a true testament to that. And hopefully, as we go through this today, you'll see some of a little bit of that. I think when you look at this slide, the first thing that really jumps out to you is, oh, maybe in fact we are, showing you a cardiac surgeon here. But I really want you to understand that my journey is very, very unique, very different. I think you see someone, born, and then all of a sudden there's a cardiac surgeon, but there's a lot that happens in between that. And in my case, it's actually a lot of struggles, a lot of difficulty, a lot of trial and tribulations, but just never giving up and just keep pushing. And I don't think people do highlight that enough. When we see successful people, I think we oftentimes get set on the fact that they're successful, and we just look at the things that went well, but people don't often talk about the things that didn't really go well. And I hope to share a very candid picture with you today and show you some of those things that certainly didn't go well for me. So I am originally from Cameroon. For those of you who don't know where that is, it's a small country west of Africa, as you can see highlighted there. It's nestled right under Nigeria on the map. And I come from the northwest part of Cameroon, which is the English speaking part of Cameroon, closest to Nigeria. And there's a little bit of a colonial history as to why, some Cameroonians speak English, but I wouldn't go into that. It's a little bit outside of the scope of this lecture today. And I did all my primary, secondary school in Cameroon, and that translates to high school here. So I finished my high school in Cameroon, and then I moved to the United States in December of 2005. I came here on an F1 visa, coming to go to school. I came here to go to a community college. And that journey would start the first of my struggles that I will be highlighting here with you today. I came here December 3rd of 2005. I came here to go to a community college, Normandale Community College. It's a school in Minneapolis. I had a family friend actually apply for me to come to that school, and it was totally random. So I come here, and the following day after getting here, that's another story, but I didn't come to this country with a lot of money. I came here with $10 to my name. Uh, Came here alone. I was a teenager at the time, and I really didn't know anyone. And my family was back home in Cameroon. I sort of went to this community college as soon as I got here, and they asked me to bring 2,700 to start school. My family had really struggled to get me out here, and that kind of money was just too much. There was not even any way I could call my parents and tell them, because I knew there was no way that we could raise that kind of money. So I was forced to take time off from school. I am highlighting McDonald's here, but I started at McDonald's, but then I would quickly add two other jobs. I was also working at Walmart and then Old Navy. I worked a lot. These were probably the two most difficult years in my life. The next 2 years that I would be out of school. I was working a lot. I was going from work to work, sometimes catching a nap on the bus. But I kept my dream alive. My hope was that I would be able to go back to college someday and hopefully do something better with my life. But over those 2 years, I raised over $50,000 in cash in my pocket. And then after all of that, I went back to the school and I sort of said, "Hey, I know I've been away for a little bit, but I'm ready now, and I can pay my way through school." There's a side story to that that hopefully I may highlight here. But in sharing this dream with you, this is a picture of me at some point when I was still in Cameroon. It will become relevant later on in the story. I did not even know the shirt I was wearing back then in Cameroon. But as whether this is destiny or what, I don't know. But I would end up at Michigan, of course. So after those 2 years, I went back to the community college, and really that kickstarted my journey in academic practice in the United States. When I went back, they wanted me to take a placement test, and I did very well on that placement test. And immediately, I was welcomed into the Academy of Math and Science, which actually came with a scholarship. They gave me a $5,000 scholarship at that time to start my community college. Things were going very well. I was lucky. I worked hard, and I did very well in school and scored very well in tests. And then I would go on to be selected as one of 26 scholars in the country following my 2 years at the community college. I was selected into the Jack Kent Cooke Foundation, and this was a foundation which was offering me over $30,000, and they had promised that they would pay my entire tuition anywhere I went to college in the world, really. And this was a big motivation for me to end up in England, where I sort of finished my undergrad because I had the backing of the Jack Kent Cooke Foundation. So I finished my undergrad in England in 2011, summer of 2011. And as I was going through that, this journey sort of it kind of pivoted a few ways. Initially, I thought I wanted to do business. So I studied my undergrad. Economics was one of my undergrad majors. And then I soon realized I didn't really like that. It didn't really sit well with me. So I thought I'd try my hand at medicine. And I enjoyed that a lot more. So when I was finishing up my undergrad, I had taken the MCATs. And I was accepted at the University of Michigan Medical School. This was a dream school for me. I fell in love with the school almost immediately. I was also fortunate enough that the University of Michigan gave me a full academic scholarship to attend their medical school, and this was huge. This was huge. It gave me the promise that I could obtain my medical education without spending any kind of money or without taking loans, which was big for me. I would finish my next 4 years of medical school at Michigan before heading to Wisconsin. But there's a little bit of a story there. When I went to medical school, I wanted to do medicine. I was not interested in going into surgery at all. And when I set up my third year of medical school for rotations, I set it up in a way that I would avoid doing surgery. So naturally, surgery was my first rotation because I thought I would show up, I wouldn't know anything, and I would really suck at it, and I would use that as sort of practice, so to speak, so that I can do well on my internal medicine rotation. And then I fell in love with surgery. They were my hardest working days, but I enjoyed every minute of it. I loved the operating room. I loved what the surgeons were able to do with their hands. And some of the surgeons, they really liked me. They thought I should do this. But I kept denying that to myself. And it's not until the fourth year of medical school when I actually wrote my personal statement to do internal medicine, when it was clear to me that I was lying to myself. For example, I was going into internal medicine, but 3 of my 4 recommendation letters came from surgeons. And when I recognized that, I picked up the phone and I called the surgeon and I said, "Hey, you guys were right all along. I'm going to do surgery." Long story short, here I am. I marched into general surgery at the University of Wisconsin in Madison, where I would spend the next 6 years. These were difficult years, not as difficult as the 2 years between high school and college for me. But surgical training, for anyone who's been through it, understands that this is sort of a military kind of training, and it takes a lot of dedication and hard work to be able to get through it. I really enjoyed cardiac surgery. I loved the fact that you could take someone so sick, take them to the operating room, and come out on the other end with them so much better off. I was always drawn to the anatomy of the heart, the physiology. You give a medication and it responds exactly how you intended it to respond. And I love the fact that it was a specialty that needed dedication. You could dedicate, but so long as you put in the time and the hard work and studied it very well, you could become very good at it. And those things were very appealing to me. So after my time at the University of Wisconsin, I would go on to the University of Washington in Seattle, which is where I did my cardiac surgery training and also did some more training in advanced aortic surgery here. And obviously, leaving Seattle, I ended up here. This is a picture of me, some sort of in my early years of training. I think for those of us who do this, who do surgery, one of the things that is sort of really exhilarating about it is that this is sort of a meditating moment for me. I think when you look at medicine today, a lot has changed. But with surgery, it's one of the things that has really been held sacred to us. It's just me and the patient in front of me with some disease that I'm fighting. This is a time when there are no distractions. I can't touch a phone. We're sterile, of course. I can't even answer my cell phone, and no one can even touch me. So it's a very sacred moment, a moment true with dedicated focus. And I think it's one of the reasons why I love doing this so much. And at the end of it, this is sort of the byproduct, or this is the end, towards the end of an operation. And you really see that you've conquered something, you've achieved something, and it's very objective. It's something tangible. There was an aneurysm here before I got here, and we've fixed that, and there's no aneurysm anymore, and the patient can sort of get back to life and do the things that they enjoy doing. One of the things that I want to highlight throughout all of this journey is the power of mentors. I certainly, I came from a family that we were very, 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 very poor. My father never finished high school, and my mother didn't even have an education beyond fifth grade. So I had to rely on mentorship. I had to rely on people to help me. People who oftentimes didn't really look like me. And this is something that I'd like to highlight, and it's very central to what I do today. And I believe in the power of mentoring the next generation, holding someone else's hand and bringing them along through the journey. I think when you look even through my undergrad, going to undergrad and not being able to start because I didn't have any money, and then all of a sudden, getting all these scholarships being thrown at me, those really helped me. They alleviated the fear of not having money, the fear of, that I couldn't be able to go to school if I didn't have money, or that I have to drop out and make money to go back to school. And I think those things are very important. With respect to the research aspect of what I do, I'm very interested in connective tissue disorders. These patients oftentimes develop aneurysms that are important to us. We're talking about ascending aortic aneurysms, of course, in patients with Marfan's disease, Ehlers-Danlos disease, and Louis Dietz. These are patients that I sort of subspecialize in, and this is kind of the milieu of research that I'm interested in. Can we find better ways of predicting which patients that have aneurysms are going to dissect and which ones are not going to dissect? And for those of you who don't understand what a dissection is, this is one of the aortic catastrophes that happens in our specialty. Usually up to 50% of patients that have an aortic dissection, they don't make it to the hospital alive. And of those who make it to the hospital alive, the mortality ranges, somewhere between 15 and 50% for this patient. So it's a very lethal disease, something that if we can understand it better, we can really help these patients. I think, as a surgeon, my impact on the community is very important. I think being able to care for the community that we live in is an integral aspect of what we do. Being able to mentor, whether they're high school students or students who are in college, or medical students or residents, people that are anywhere along the path of getting to this position is something that I'm very interested in. Also, naturally speaking, as a Cameroonian, this kind of care is care that I'd like to be able to bring not just to Cameroon, but to the continent of Africa, because there's certainly lots of patients there who have cardiac surgery diseases, but there aren't really many cardiac surgeons in that continent who can really sort of provide this kind of care. So one of my goals is to be able to sort of bring this kind of care to a setting like that. But anyhow, this is sort of sort of ties it in here, and I think again, oftentimes people just see the start and the end, and they just want to see me as a cardiac surgeon. But I hope that from this talk you've gathered that this doesn't really happen overnight. It takes a very long time, and it doesn't happen without you surrounding yourself with a lot of people. And certainly it doesn't happen without, lots of failures along the way. In my case, the biggest one being the fact that I come from a family that didn't really have any money or have, parents that were in the medical field. And I had to drop out of school and start at a McDonald's to end up here. And if you're watching this and, you're a physician and you would like to collaborate with me, that's great. But if you're also watching this and you're someone who finds yourself somewhere along that path and you would like to reach out and just, and listen to more of this story or ask any questions and see how I can help you along the way, that's also great. But thank you for your time, and I look forward to hearing from some of you.